Happy Friday and welcome back to Living East Tennessee. I'm Erin Barnett and with Dr. John Milligan from Milligan Vein. Thanks for coming in today.
Thanks for having me.
We talked a lot earlier about how it is Heart Month, and so we wanted to kind of continue this topic and kind of deciphering between what is heart disease symptoms versus maybe some bad veins or veins issues.
Right. So everybody thinks, they get older, their ankles start to swell. Frequently their doctors will put them on fluid pills. That's kind of the treatment of heart failure. But frequently it's not really their heart, it's actually their veins are no longer working. So they wake up in the morning, their ankles are normal. As the day progresses, gravity pulls the blood down their legs because their directional flow valves aren't working in their legs. When that happens, their ankles swell up, and by the end of the day, they go to bed with kind of cankles.
Okay, so a lot of pain that can go along with that, some of the other symptoms that people deal with.
Right. Frequently they get pain, but a lot of times the pain doesn't really happen until you lay down in the bed at night.
I see.
Then they start to get aches and cramps. Those veins have been overdilated throughout the day and stretched out. When that pressure goes out on those veins, spasm and cause cramps and aches.
All right, so what are some things that we can do if we're dealing with those issues?
So elevate your legs. You can wear compression socks. Both of those things will help manage it. Big thing is come in and see me. I can evaluate your legs with an ultrasound, make sure your directional flow valves are working the way they should. If they're not, we can seal those leaky veins off, reroute the blood back through the healthy veins. Most people say they're somewhere between 70 to 90% better.
Wow, amazing. What do people need to know more about coming in to see you? I mean, of course, you guys will sit down and figure out what's going on first and kind of map everything out.
Yeah, so how it works is you come in, you meet us, I'll evaluate you and make sure you need to have an ultrasound. The ultrasound will show me directional flow of the vessels. If we find that they're leaking rather than bringing the blood back uphill to your heart and the blood's just pooling in your legs, we then have to try compression hose. We'll try to manage things medically. However, if that doesn't work, you come in for an office procedure, which takes about 15-20 minutes, seal the veins shut, your body automatically reroutes the blood through the path of least resistance.
And you all heard him say 15 to 20 minutes. I mean, we're not talking about a huge amount of time, and you can do it right there in the office.
Right, it's done in the office. Historically, people remember grandma having their veins stripped, and it was a horrible procedure. Tons of pain, took 6 to 8 weeks to recover, and the long-term results weren't near as good as what we offer currently.
Well, tell people where they can come and see you all.
So we have offices in Knoxville, Crossville, and Morristown.
Awesome.
So Milligan Veins, the easiest way to find us. We have surveys and questionnaires that hopefully will help you.
Great, and all that information on your screen. Thank you for coming in. What would you say to that person who's maybe been putting this off, that now is the time?
Forget about what grandma had and take care of yourself.
All right, thank you, doctor, so much.
All
and we'll
right,
have all that information for you all at home on livingeasttennessee.com.